Yes, it is Fertility Focus on Rhythm 93.7. We're looking at the male factor in infertility. Fantastic conversation we're looking forward to having this beautiful day. And we have none other in the studio. We have Dr. Kunle Ajayi. He is the guy. Dr. Kunle, so good to have you join us on Fertility Focus on the show.
Thank you very much.
Yes. I did read out some fantastic statistics for you there, and I would like you to respond to that.
I'll be surprised that even male factor, the man in the relationship, is responsible for about half of the causes. And you said it. So men and women contribute equally to infertility, and until we start coming to terms with things like that, we will have problems. We come to clinics sometimes, we see the women coming in for tests. To get the men to come in to have their own tests done is a
huge challenge. When is a man considered infertile?
So we define infertility as inability of a couple to achieve pregnancy within 1 year of cohabitation or living together.
Okay.
So if a man has been living with his wife for a year and there is no pregnancy, we can say well, there is infertility, isn't it? Aspect of the definition, which means they need to be having unprotected sexual intercourse.
Okay.
So they're not going to be using contraception in any form.
Okay.
And they're only going to be abstaining.
Yes.
So throughout that 1 year, they are having sexual intercourse regularly. Regular meaning that they are just having about 2 to 3 sessions a week. If a man is not capable of achieving an erection,
sustained erection,
even achieving one, it's a problem. They can't sustain one, it's a problem. He does not ejaculate, it's a problem. What if he doesn't even produce any sperm at all? But he produces them in very, very small quantities. Or even if he produces them in good quantities, many of them are dead, or they are not moving. Or so many things within the sperm that should be there. Sperm should be viscous. Viscous means thick. If it's too watery, it becomes a problem. If the acidity or the alkalinity is different, it's a problem. So there's some certain criteria that must be met. For you to say these sperm parameters are good. So the volume must be good. So it must produce about 2 to 8 mils of the ejaculate. The concentration should be at least 15 million per mil. The number that's moving should be about 50%. So all those kind of things should be there.
Fantastic.
So if at any point in time those parameters are skewed one way or the other, then they are. So a man's lifestyle could actually contribute adversely to his fertility. So if a man drinks excessively, alcohol can affect the liver, and a liver problem could actually even lead to erectile dysfunction and other things. So that could be a problem. If a man smokes cigarettes or even marijuana, those have been shown to reduce sperm quality. In so many different studies. Exposure to chemicals, maybe where they work, factories and things like that. Some drugs, for example, bodybuilders that use anabolic steroids. Those steroids contain testosterone and other things. Those testosterone might affect sperm production. So sometimes it could even be a family history of infertility or something like that. Somebody who has had previous pelvic surgery. A man that's had like a hernia, like a groin hernia, and maybe they mistakenly tied the spermatic cord or the vessel, that's the blood vessel to the testes. It could even be somebody who got kicked in the testes for one reason or another. So all those things
are risk.
They could actually be risk factors for infertility. Sometimes instead of the sperm coming outwards, it goes back into the bladder. Something we call retrograde ejaculation. So there are
what about high blood pressure?
In fact, some high blood pressure medications might even predispose to this, but not. I wouldn't say you shouldn't take your medications. Don't look for one that likely to not affect your,
I think I have issues with fertility.
So I think the most obvious one would be being with a woman for a year and not being able to achieve pregnancy.
As after it's been identified that the woman is not the issue.
I mean, even if you think the woman is the issue, but you've been with her for a year and nothing is happening,
Yes.
I will suggest that both of you go get tested. That's number one. The number two, you might even find out that you are having difficulty achieving or sustaining an erection. So that one alone should also prompt
some activities, some concerns.
Yes. It could also be that you notice some changes in your voice. Maybe your voice sounds a bit higher than it used to be. It could be that your testosterone levels are low for one reason or the other.
Wow.
Yeah, it's funny.
Take the voice on again.
Those are not the way they should. And the man starts speaking in a high-pitched voice because of one thing or the other. So it happens.
Oh.
If you notice that maybe you were hairy and all of a sudden
start losing your hair, falling off.
Not about male pattern baldness now.
Yes.
About body hairs and things like that.
Wow.
Notice that your testes looks a bit smaller. Then those are some of the things that you might see. But most of the time, there are no symptoms apart from the fact that you've just been trying and nothing is happening. So take for example erectile dysfunction. The man cannot achieve an erection.
Yes.
There are so many medications now that can be used to correct that. I won't mention the names, but I'm sure.
It's the way to pay for material. Yes.
So it's better for you to come in and let's even find out what is causing that erectile dysfunction. All the possibilities. So if it's due to drugs, for example, you say, please stop taking those medications. If you drink too much alcohol, please try to limit or even stop it completely. If you think you're exposed to some chemicals, that might be predisposing you to this kind of thing, we also say avoid them. Going specifically to the sperm parameters now, because I told you about volume and things like that. So we try to look at those because if the volume is not good enough, it probably will affect fertility. Yeah. If the concentration is not enough, it can affect fertility.
It is the quality.
Yeah. So there are times when when you look at all those parameters and you think that it's not so bad, we can actually do some things to make the volume better.
Yeah.
Maybe drugs. But it could also be doing something called something called sperm washing. Where the sperm is washed and concentrated and then injected into.
Not like an IVF.
It's not IVF, but IVF would be like the next step. So after we try the intrauterine insemination, if the concentration and the volume and the count is not too low, you can do that one. Yes. It's not as expensive as an IVF.
Okay.
And it works. Okay. If you choose your patients carefully.
Fantastic.
But where the count is very, very low,